Well, hello everybody. Welcome to the Healthy Joints Healthy Lifestyle Show. So for those who don't know me, my name is Dr. Arinola Dada. I help people with joint pain become pain-free and people with autoimmune diseases get their immune system back on track. So boy, do I have a treat for you today. This is my dear friend and superb dentist, Dr. Valerie Mukanga. She is a dentist that practices in Texas. She got her doctorate of dental surgery at the University of Tennessee in Memphis. And after her graduation, she completed General Practice Residency program at the Bronx-Lebanon Hospital in New York City. Dr. Mukanga provides excellent, and I'm going to say excellent because I know her and I know the quality of care she provides. Excellent quality dental care in a very friendly and comfortable environment with a strong focus on integrating overall health into oral care. So we're going to talk about that, and patients are going to say, hey, what does that have to do with autoimmune diseases? You're going to find out. So let's talk to Dr. Valerie. Please tell us, why do you do what you do?
Hey, doctor. First of all, even before I start that, thank you so much for having me today. And I'm looking
Happy you're
forward to a
here.
fantastic conversation.
Yes.
So why do I do what I do? I do what I do because so I decided to get into dentistry because plenty of people in my family had dental problems. I
Mm,
always talk about one of my aunts who I remember she was suffering from halitosis or bad breath.
mm,
And it was always hard for her to just like, how, back home in Africa, you come back from school and you just hang out. There's so many people living with you, not just like your brothers and parents.
yeah.
And so, you're just chilling, chatting and, chatting away. But every time, like she couldn't be herself, because she always was so self-conscious. She also had cavities. So that
Yeah.
was one of the things. But also, even myself, when I was younger, I lost a front tooth and it was only
Mm,
restored by a dentist. So that also,
yeah.
kind of marked me. But like
Yes.
the thing that happened as well, and that was just really sad and crazy at the same time, is that my uncle, which is like my mother's brother, the one who came just after her, passed away
Yeah.
because he ended up
Oh.
having a cavity and then he got infected because
Oh. Mm,
we don't really have that habit of going to the dentist. So when he
yeah.
went to the doctor, it was quite late. He ended up having a stroke and actually
Oh
passed the
no.
same.
Oh
So when
no.
I
Sorry to
was
hear
told, I
that.
was like, I don't think that's the truth. I think they're just making up a story. But then it's only when I went to dental school that we talked about, how then poor oral hygiene can affect the rest of your
Yeah.
body. That's
Yeah.
why I like to kind of like advocate for people
Yeah.
to actually go and see the dentist. But those are
Mm,
some of the points or the things that led me or
yeah.
encouraged me to go into
Wow.
dentistry.
Wow. Wow. Yeah. Yeah, definitely. I think, yeah, when we go into medicine and dentistry, you usually find out that there's some personal stories
Yeah,
that kind of galvanize us and kind of help us with that momentum through the
yeah,
process. But thank you so much for
right.
sharing that personal story there. So,
Mhm.
one of the things that we would like people to kind of their minds around is how does oral health kind of affect overall health? Can you tell us a little? Because a lot of people just kind of feel, well, I'll see the dentist. Nobody likes to see the dentist anyway, because they're always
First of
associated
all,
with pain, right? But how does
yeah.
oral health, and meanwhile, they're running marathons, they're eating healthy and all that, but they're kind of neglecting their oral health. So how does that
Right.
affect their overall health, would you say?
So it definitely affects your overall health. Remember, like one of the things that I just talked about, in fact, it was the story of my uncle. So, basically when you have poor oral hygiene, it can affect you in so many ways. It can affect your mental health. In fact, because there are so many people who come here and say they have lost a couple teeth, some front teeth, and then they're like, "Oh, doctor, I really need I really need to be checked because um I work in the front desk and they
Mm,
trying to get a job or they work in the front desk and they don't feel their best self, like they feel like they can't really put their best foot forward
yeah.
because they're having dental issue. Or
Yes.
say for example, like my aunt, they have, halitosis or bad breath.
Yeah.
Then when they are in front of people, they're so self-conscious. So
Yes. Yeah.
those are kind of like some of the things that can affect, but even not just that, but like there's a correlation between oral health and poor oral health and diabetes or,
Yes.
things like that does
Yeah.
affect the rest of your body.
Yeah.
So it's very important to understand that we do have one body, even though
Yes.
like in the healthcare system here in the US, things are like kind of like put into different categories. When
Yeah.
you look at it, even with people getting, their insurance. You have medical
Yes.
insurance, then you have dental
Yes.
insurance, you have vision. But
Yes.
honestly, it is one body. It's not like your mouth is separate over there.
Yeah.
Treating your mouth
Yeah.
affects the rest of your body, and affecting the rest of
Yeah.
your treating the rest of your
Yeah.
body also
Yeah.
affects your mouth. So yeah,
Yeah.
it's just one human body.
Body. Yeah, I totally agree. Yeah, it's kind of a false idea of compartmentalization, right? Okay, I'll
All
see
right.
people feel I did my annual exam, I'm good. And then I
Mm,
think when their vision starts to deteriorate, yeah, let me go use that eye insurance, right? And then
right,
when
right.
they're like, I think I'm having some debt, I'm going to, meanwhile, they're like, oh, I'm keeping up with my annual physical. But with that, should
Mm-hmm,
be the dental, should be,
mm-hmm.
making sure they're getting eyes checked. Yeah, because although it's on different insurances, it's really just one body and all this artificial
Exactly.
compartmentalization, just like you said,
Exactly.
is really that's it's ridiculous really because it is one body, like Dr. Valerie says. Okay, so next question, which we've kind of alluded to a little bit, but just for emphasis, what are your thoughts about poor oral health impacting like mental well-being and quality of life? Any thoughts on that?
Absolutely. So yeah, we kind of like allude to it, but it really is tightly connected. There's some just mental health. I remember seeing the story of this lady. Um she had like an intervention by a dentist because she had lost a lot of her teeth, and um with that she met this amazing guy, right? And the guy actually loved her to pieces, and he did not see that as a problem. But she was so embarrassed. She didn't want to go on a date. She didn't want to do this. She didn't want to do that. And so finally, she was able to locate a dentist that actually did the treatment overall, gave her a brand new smile. And now she's sore as far as like her personality. Now, she was her best self. But you see how that affected her, even like in a
Mental health.
close-knit
Yeah.
relationship,
Yes. Yeah.
her mental
Yeah.
health. And so
Yeah.
even, some people, they just come and they're in so much pain. Just being in pain, how can you really function in the society? And due to maybe like a huge cavity that was neglected and things
Yeah.
like that, so your mental health and even self-esteem can
Yeah.
heavily be
Definitely.
affected by poor
Yeah.
oral hygiene.
Yeah. That is
You
so,
can be
yeah.
judged even,
Yeah.
like say for
Yeah.
example, I know that people say, when you're trying to get a job, you cannot be discriminating against religion, race, all
Yeah.
of this and
Yeah.
that. But yes, who is to say that when you went to the interview and
Yeah.
you smile, or maybe they smell something unpleasant, who is to say that that's not the reason why you were not
Yeah.
hired,
Yeah.
regardless of your
Yeah.
credential, of
Yeah.
your expertise? Who is to say that you were
Yeah.
not discriminated against? you,
Yeah,
you
that is
know
so true. I mean, and I think even in the mind of the discriminator, it's really
Mhm.
more about, does this person fit the image of what I want from my front desk, right? And it's a yes or
Right,
no. And it may not necessarily be like, oh, I want to discriminate against this person because this person doesn't have front teeth. It's more like this
right,
person doesn't fit the image that we want to present at, for instance, the front
right,
desk or anywhere
right.
that's customer
Mm-hmm,
facing, patient facing. So I can totally see that. And for the
mm-hmm,
person on the other side, it's part of that mental health, mental
mm-hmm,
well-being. But
mm-hmm,
interestingly, there's some studies that actually also show that even the poor oral hygiene can lead to things like rheumatoid arthritis. So, we're still trying to figure rheumatoid arthritis out, but we do know
mm-hmm.
that those bacteria can be triggers. So that's kind of another reason, in addition to things like mental well-being, that we know
Right.
that not having good oral hygiene can trigger your immune system too. So in
Mm-hmm,
addition to kind of the mental well-being, like Dr. Valerie
mm-hmm.
said.
And
Okay.
another thing too
Yes.
that I can pinpoint is that there's also, while you're saying there's a correlation between oral hygiene and, say, for example, rheumatoid arthritis, there's also a correlation between poor oral hygiene and Alzheimer's disease.
Oh my
You
God.
know,
Well, that's enough to wake anybody up.
exactly. Yeah. So that's
You lose
yeah,
your teeth, you lose your mind. My God. Okay.
yeah,
I think
right.
everybody's rushing to the doctor. Better go knock on Dr. Valerie's door and be like, okay, I need my dental exam like ASAP. Oh my goodness.
Yeah.
Okay. So what are the recommended practices though? So now we've kind of told people about, hey, you got to pay attention to it. It's part of your well-being. It can trigger autoimmune disease, it can freaking trigger Alzheimer's. So what do we do then? What are the recommended practices for maintaining good oral health so that we can support kind of the overall health?
Right. So people definitely need to go visit a dentist at least twice every year.
Okay.
Okay.
Twice a
Because
year.
then, yes, twice a year. So when they come, and the good thing too is, like, for people who do have insurance, oftentimes and more times than none, the insurance will pay for those
Mm-hmm.
exams twice a year.
Okay.
So at home though, that's very important because yes, you do go to the dentist, they do see you twice a year
Yeah.
if everything is fine. If you have some issues that need to be taken care of, then yes, you're going to go more until everything is taken care of.
Yeah.
However, at home, what you do at home is very, very, very important. You
Yeah.
do want to make sure that you do brush your teeth at
Yeah.
least twice a day. So is
Yeah.
that twice again? In the
Yeah.
morning and in the evening as well. In the evening,
Yeah.
it's very important to brush your teeth at night after you have finished your last meal,
Yeah.
because you're going to be removing the debris that are stuck between your teeth and on your teeth, and
Yeah.
also you're going to um, you're going to floss as well,
Yeah.
once a day at least. And to me, I find it best to me to do it at night when everything you're done with your day. You
Yeah.
have removed all the debris that get stuck between your teeth before you
Yeah.
go to bed. And the
Yeah.
reason why brushing at night and conducting your oral hygiene at night is very crucial is because you have a decreased amount of saliva
Yeah.
when the night comes, and with that,
Okay.
so saliva
Wow.
actually uh, make it difficult for bacteria to adhere to your teeth, causing cavities. So at night, because we have a lesser flow, you can understand that bacteria
Yeah.
will actually, have a better access to your teeth, damaging them and causing cavities and such. So it's very,
Okay.
very important to do that
Okay.
at night. You can
Okay.
use mouthwash. That's very good. You can do that as well. But really, like, what we stress upon is really brushing twice a day and also flossing at least once a day. And
Okay.
you want to make sure also that you brush your tongue. You also brush all the surfaces in
Yeah.
your mouth, so your cheeks, because that can also accumulate debris, causing
Mm.
bad breath. But it's
Okay.
very important, besides that, to also take care of what you eat. You want to make
Yeah.
sure you drink plenty of water. Your nutrition
Yes.
is crucial, because
Yes.
if you are eating lots, you're doing good there. If you are eating lots of starchy food that gets stuck, because oftentimes people, when they associate cavities, they understand the connection between eating sweets and having cavities. But it's not just that. Even lots of starchy food, like a lot of things that get caked up on your teeth, like chips,
Mm.
like breads and things like that. So
Yeah.
anything that can get caked up upon your teeth can
Yeah.
also foster
Yeah.
that. So you want to
Starchy
make
foods.
sure that you watch out as
Mm-hmm.
far as what you eat. You
Mm-hmm.
want to eat lots of fibrous food that's going
Mm-hmm.
to help you
Yeah.
keep things clean. And
Mm-hmm.
yeah, so those are kind of like some
Yeah.
of the things
Okay.
I
Yeah.
want
Yeah,
that
that
you
is
want to be.
so, yeah, that is so helpful. Visit a dentist twice a year. Make sure what you're doing at home is so important. Flossing at night, remembering that you don't have a lot of saliva at night. And so
Mhm.
that's the reason you want to also think about brushing your tongue and your cheeks. Make sure bacteria is not accumulating, drinking lots
Mhm.
of water, like Dr. Dada just did, and kind of watching what kind of sugary foods you're eating. So it's not coating your tongue and letting those bacteria like multiply and quadruply. But one of the most important important takeaways that I learned from this is good oral hygiene can help prevent dementia. So with that, I am going to make sure, and I think every single person that is going to watch this is going to want to know, Valerie, how can we find you?
So yeah, so we are located. I'm the owner and founder of Healing Wings Dental, where we help people maintain or regain their oral health, and so that they can soar in life. So we are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. Our number is 972-213-0202, and our website is healingwingsdental.com. But we can also be found on social media, on Facebook, on LinkedIn, on Instagram, on YouTube, where we kind of like share some information about oral hygiene as well.
Okay. And all those links are Wings Dental. And so I'm going to have everything at the bottom of show notes. Thank you so much, Dr. Mukanga, for coming to the show and lending us your expertise.
Thank you so much for having me. I appreciate it.
Okay, so for everyone, thank you for listening. If you think this video is helpful, like it, subscribe to the Healthy Joints Healthy Lifestyle, share this with anyone that you love that you think would benefit from it. But remember, making sure that you have great oral hygiene is going to prevent us developing dementia. Okay, if nothing else. Thank you everybody for listening. Take care.